evening. This is 21st Century Conversations. I'm Enzing Ashani. Our conversation this evening is about the Affordable Care Act. And this is a workshop to help you in the community to know exactly how to go about signing up and to tell you why it is important that you do so. With me this evening, I have people who are on the front line of Access Health, and they're going to introduce themselves to you and tell you exactly what it is that they do to help you to become covered under an affordable care health insurance. And so I'm going to start with Denise Smith, who is from Access Health. Denise, tell us who you are and briefly what you do.
Hi, good evening. My name is Denise Smith, and I'm the training coordinator at Access Health Connecticut, part of the Navigator and In-Person Assister Outreach Program. And my job was to create the training for certified navigators, assisters, and certified application counselors.
Thank you kindly. Daisy?
My name is Daisy Sanchez, and I am an assessment specialist at Community Action Agency of New Haven, and I'm also a certified in-person assister for Access Health CT.
Thank you kindly. Kiana?
Hi, my name is Kiana Lewis. I am the Navigator Coordinator for the New Haven region. The Navigator organization is the lead community organization to provide education and enrollment support for the community.
Thank you kindly. Now, you've heard much about the Affordable Care Act. You've heard many negative things as well. But we're here to tell you that the Affordable Care Act, it was not designed to cause you problems. But as with anything new, it takes a while for people to understand how the system works and to navigate the system, which is why we have assisters and navigators to help you to do just that. And this evening, we're going to provide you with some key pieces of information that we hope will make the process easier for you. And so we're going to ask Denise to first tell us why is it important that people sign up for this affordable care?
Sure. Well, health insurance is designed to help you pay for the cost of your health care. Having health care coverage can help protect your family in case a medical occurrence or event happens and high medical bills may be incurred by the family. But even more, when you have health insurance, you're more likely to actually have better access to health care. The U.S. Department of Health and Human Services, their report shows that people who have health insurance coverage actually have better access to health care and that they're more likely to get the care that they need, the type of care they need when they actually need it. So with the passing of the Patient Protection and Affordable Care Act, there are new benefits and protections that are now available to millions of Americans for the first time, and many of them went into effect January 1st, 2014. Some of those benefits include the inclusion of emergency services through your health insurance plan, hospitalizations, mental health and substance abuse services, pediatric dental and vision services. And some of the protections, one of the most important, is that no one can now be denied coverage because of a pre-existing condition.
Okay, thank you kindly. So, for the next 50 minutes or so, you're going to hear how to get financial assistance through Access Health. We're going to talk about free Medicaid expansion coverage. We're going to give you contact points and specific ways that you can find help. For this program, we're focusing our details on the Greater New Haven area, and we will provide you with the phone numbers to call to get the kind of information you need. One of those phone numbers, of course, is 203-946-2227, and that is showing on your screen, and that is the New Haven Health Department. And there's also the statewide call center, which is 855-805-4325. And throughout the program, you will get this information again. We will, of course, also explain to you that there are penalties for not signing up. And we will give you a accesshealthctcommunity.org website where you can go to get much more information. But for the first segment, what we're going to do is to help you to find out, to learn the criteria on which people can decide which plan they want and can afford. And so we're going to start with you.
Okay. I want to start with 3 simple things that I think individuals or families should consider when they're planning to enroll through accesshealthct.com. The first question is, who really needs coverage in the family? This question is important because you're going to need to gather information about those family members who want to enroll, and this also is going to make sure that all of those members of your family are actually on the application and that you have a chance to enroll each of them in the coverage that they need. The second question that I think is really important is for people to know what current healthcare providers they're receiving healthcare from, or what services they're going to need before they complete the enrollment process. This question is very important to ask because when you enroll in a health insurance plan, you want to make sure that the providers that your family are currently receiving services from are actually in the network of that health insurance carrier and of that plan. If the provider is not in that plan, then you may have to consider going out of the network, or you may have to consider finding another provider for that service.
I just want to interject there. I want to ask you a question about that. When you say go out of the network, can you just briefly tell us what that means?
Sure. In general, each of the carriers, and there are 3 that are available and who provide private health insurance through Access Health CT. They are Anthem, Connecticut, and Healthy CT. They each have a network of providers and services that they give that consumer access to when they enroll in a health insurance plan. So, and this is a relationship that the individual provider or the group or the hospital develops with that health insurance carrier. So you want to make sure that the provider that you are receiving care from is covered by that health insurance plan. That's what we call being in network. Now, if that provider is not available, you can go outside of the network and still receive care from that provider, but it may cost more.
Okay, is this something that when we go to sign up that the assister would address for us, or we could address these questions to the assister or to the navigator?
Yes, this is a very important question, and all of the certified assisters and navigators know that this is a really important question to ask consumers when they're preparing for the enrollment process. Wouldn't you agree?
That's correct, yes.
Anything to add to this, Karen?
And oftentimes, if you don't, a lot of our clients don't come to us knowing the doctors they want, or this might be the first time they've ever had health insurance.
Yes.
But this is a great opportunity for us to introduce them to different doctors and where they might be. So on the portal, which we'll get to later, they'll have the opportunity to look on the individual plans' websites and look at the doctors and where they're located, and so their options of doctors in general. So it's a really good opportunity.
Oh, so that's important to know that there's actually a portal that can tell them. So for example, for people who have pre-existing conditions and know that they have certain needs, this portal will tell them where the doctors are who might be able to serve those needs.
The sister can lead them to a website that will help them find that information, yes.
Yeah, because you know, one of the problems people normally, many people who don't have health insurance use the emergency room as their primary provider. So they've never had to identify a doctor outside of, you know, the emergency room where they get primary care, and you're saying in this program they will be able to do that.
Right.
Okay. Anything else that we should know about this?
Sure. So the last really important question that we want people to think about, we want them to think about the cost and the impact of having care or not having care. And so we know that for most people, this is the first time that they're enrolling in a health insurance plan and they may not be familiar with budgeting for a health insurance premium. Many of the processes and the steps may be new. But what we want people to remember is that there's a great cost of not having care. The first cost is that a penalty could be assessed to each member of your tax household if you are without health insurance coverage for 3 months or more in the calendar year. And the second thing is that you may incur very high healthcare costs should a medical incident happen to you or your family. So we believe thinking about that really moves people to want to enroll by March 31st of 2014, because the quicker you enroll, you will avoid paying a penalty, but you will also have a chance to access healthcare coverage immediately.
Okay, we're going to go into a role-playing segment now for you to show, for you and Daisy to show people exactly how this works. But I just want to reiterate, you said that there are 3 organizations providing care for people who are taking the regular health plans: Anthem, Healthy CT, and Connecticut. So those are the 3.
Those are the private plans.
Those are the private plans. And the public plans are
Husky.
Husky. Anything else? I thought Access Health CT isn't that both public and private? No?
Well, Access Health CT is the overarching marketplace where people
Okay.
can go look for insurance.
Okay.
But the 4 plans, or the 4 coverage options, are Husky, Anthem, Healthy CT, and Connecticut.
And Husky has a range of things. There's Husky A, B, C, and D, right?
That's correct.
Okay, okay. And so now we're going to go into signing up for a plan. We want to show you just what are some of the questions and some of the documents and all that. So Daisy and Denise are going to role play for us to show you how you go about signing up for a plan.
Okay, so this is a really simple example of what the enrollment process would be with an in-person assister. I'll introduce each section, and I just want to reiterate that the enrollment and the application process can be different for each person and each family, but we'll give you a simple overview of the process from beginning to end. So Daisy, tell us how you introduce your services as a certified assister.
Well, basically, I meet with the client. I express to them that to be confident and making them feel comfortable that all the information that they will give to me will be private, and they also do fill out a consent form. I make them feel comfortable and through the whole process, and assist them with any questions or anything that they may have. I try to make it as easy as possible for them.
And so that consent form gives you access to their private health information or their personally identifiable information only for the time period that you're with them. You don't keep that information.
No, I don't keep that information. Once we finish the whole process of the application and they select their carrier, then they take that information with them.
Okay, and do you review the enrollment checklist with them?
Yes, I do.
Okay.
We go over the checklist. Some of them may have all the documentation, which it entails the 2012, 2013 income tax or the W-2, their last 4 pay stubs, and also we ask them if they have a projected outcome of the income for 2014 also.
Okay. Now, if a person is ready to start the process using the website, accesshealthct.com, I know that you have to create an account online. What are the steps needed to create a basic account?
Okay, we provide them with a form. It's a very easy form. It's asks their name, address. They create their username, and they also create their password. Plus, also, if they forget their username and password, then there's specific questions that they have to select from a list of questions, and we go over that information. So they select 4 questions. Once they finish that paperwork, then we go into the system and create their account.
So it's important that people write down their username, their password, the questions, and the security answers so that they don't forget that information.
That's correct.
Okay, so at this point, are we ready to begin the application?
Yes.
Okay. I know there are lots of sections to it, but why don't you just give us an overview and what are the basic pieces of information that we need to move through the application?
Well, basically, once I've assisted them in helping them create the account, then we go to the first screen, which has a series of sections that I explain to them that we're going to go over. And every time that we go over to one section, it gets marked off. So, and once we start with the questions that are asked at that section, then we go to the next section. But every time that we go to a different section, we have to confirm to make sure that that information that we are submitting is correct. And I let the client read thoroughly that information.
Okay. And what are some of the most common problems that you see in completing the application? I know both you and Kiana can talk to that, but what kinds of things are the most common mistakes or the pieces of information that are often missing? What confuses people about the application?
A lot of people really get confused about what the tax household means. Your tax, so who you claim on your taxes, a lot of times people might live with a lot more people that are actually on their taxes. So the sisters provide invaluable information about how to sign up and how to choose how many people are in your tax household. So to make it plain, I'll give you an example. So if you are John and you have 4 people living in your house, but you, John, only claim 2 people on your taxes, for the purposes of enrolling, there are only 3 people in your tax household. Not to totally dismiss those other people in your house, but to be clear, it's only the people that are on your taxes include your tax household. So that kind of confuses a lot of people sometimes.
Let's also talk about how we help people to verify the monthly income. What can people bring in terms of documentation?
For the current month worth of pay stubs.
Okay.
And also, sometimes I ask them for the W-2s. Like, for example, a lot of people for 2013 will be getting their W-2s. So I've asked them to provide that information so that we can then move forward with the application process.
Okay, we only have a few minutes left in this segment, but I want to clarify something. If for a self-employed person, for example, they might not have a W-2. So if I'm self-employed and I was self-employed for, say, 8 months out of 2013, what would I give you?
So the tax information is going to be really important.
Yes.
We'll make the assumption for this scenario that the person does file taxes, so they would still bring their 2012 tax return, their 2013 if they've submitted it already, but most people haven't, and then the projected for 2014. But they can also submit bank statements and other documentation to support their varying income. Because we know with the self-employed, there are seasons when they may make a lot of money and other seasons when they don't.
Okay, and what are the other key things in the next 2 minutes? Tell me what are the key things that any one of you or all of you can, you have about 2 minutes to tell me what are the key things people need to know about signing up.
Okay, so we've gone through the application, and Daisy told us that we're able to review the whole application so that we can see everything and make sure that it's correct. Let's talk about choosing a plan, okay, selecting the plan, and actually enrolling in the plan. Do you guys just want to talk about that?
Okay. Once we go through the whole process of the application, then there's an eligibility determination that is, and it will show if the client is eligible for either Husky, qualified health plan, or qualified health plan with tax credit. And once the client selects what they want to choose, then we have to confirm the, well, they can select the plan or the carrier that they want, or they can stop right there, do their homework in regards to the health insurance, what carrier they want to select, and then they can come back to me and we can then on another day finish the process once they do their homework and seeing what is available for them.
To piggyback on what Daisy said, once you get to the eligibility page, you will have an option of, depending on if you're eligible for Medicaid or a qualified health plan. If you're eligible for a qualified health plan, you're usually given a lot of options. And she mentioned going home and doing your homework. And what she means by that is you have to really know what you need or what services you might need in the coming year. So that will decide, what kind of premium you choose, what kind of deductible you can handle. So oftentimes you need to go back and make sure you know how much money you're going to spend on health care, what conditions you might need serviced, what doctors that are essential to your care. Are they on the particular plans offered? So
Now, is that how you decide whether you take a bronze or a gold plan?
So that's a really good point. So we mentioned the 3 carriers that provide private health insurance through Access Health CT, Anthem, Health ECT, and Connecticut. But what we didn't talk about were the plan tiers. And so I know word has probably gotten out by now that there are 3 plan tiers that are offered by each carrier: a bronze plan tier, a silver plan tier, and a gold plan tier. And what's really important to know is that all of the tiers carry all of the same essential health benefits and protections that are included and mandated by the Affordable Care Act. But there is a differentiation between the percentage or the amount of premium that the plan carrier will pay or that the individual or the consumer will pay.
Okay, we're going to stop right there for this segment, because in the next segment we'll have to talk about what are some of the really important things that you think people need to know before they determine what plan to choose. And Ken, I want you to sort of get in there and give us some of these key pieces of information, because I know at the health department you deal with a broad cross-section of people, right? Okay, so I want my audience to know you're watching 21st Century Conversations. We're talking about signing up for the Affordable Care Act. This is actually a sign-up workshop where we're showing you, these people who are my guests this evening are showing you what are some of the issues you might face in deciding when to sign up and what to sign up for and what is available to you. And we just did a role playing where Daisy Sanchez, who is an assister, she's a certified assister with the Community Action Agency, and Denise Smith, who is the person responsible for training the assisters and navigators for Access Health, was showing us what are some of the questions you might be asked when you go to, and what are some of the documents you need to take with you. So now let's move into the next segment and talk about what are the critical pieces of information people need to know about selecting the plan. As you said, it's important to know what medical services you're going to need, right? What else is important? You guys now take us through what are the next key pieces.
Well, the first thing I just want to make sure that we state is that it's very important that if you need health care coverage and you need health insurance, you're not currently covered under a plan, that you enroll by March 31st, 2014. The sooner you enroll, the sooner you'll start enjoying the benefits and protections that are available under the Affordable Care Act, and you will also avoid the penalty, and that's really important for people to know.
Now, some people, Kiana, who have had health insurance, but were told by their carrier that they can no longer have insurance privately. They have to sign up through Health Access Health. What are the reasons for that, and what can they do, and what should they do?
Well, media gave a really different perception of the reason certain plans were discontinued. But under the Affordable Care Act, there are 10 essential benefits
Oh,
that are
okay.
required
Okay.
in each plan, and many of those plans did not include those. So people were paying outrageous amounts of money for plans that weren't all encompassing. And now these plans include the essential benefits. For example, being a woman is no longer a pre-existing condition. You know, so it's those benefits that are essential now in all of the plans. And that's really, you get a better plan. We're not taking away, you know.
So I think that's very, very important for people to know. We're not taking away the Affordable Care Act is not taking away anything
Right.
from people. It's actually trying to ensure that people have all the basic needs, their basic medical needs met. And for example, pre-existing condition, you know, if you suffer from asthma, for example, they cannot raise your premiums just because you have
Right.
asthma. You can get coverage.
Right.
That is so important because I know I was asked recently about that. There are people who have been taken off plan and people were kept on, and we noticed that there were different premiums people were paying. So it seemed as if the insurance companies are cherry picking who they want to keep and who they don't keep based on what they're paying and based on what the plan offers. Now, anything else that we need to know?
Yes, I think it's very important just to clarify for people, as Kiana said, that the Affordable Care Act adds to the quality of care and the services that are available. So one simple thing to remember is that you can still purchase a health insurance plan outside of Access Health CT if you choose, but only through accesshealthct.com or through our call center will people have access to financial assistance to pay for their health insurance premium. And so this is another really important benefit that was created by the Affordable Care Act.
I like to compare it to paying for a flight. If you wanted to fly somewhere and you wanted to take Delta and you go on the Delta website, you're going to pay the full price at Delta's price. But if you go on Travelocity, you might find that exact same price for a deal. And so that's kind of the dynamic that Access Health CT sets up, where you can find the same plans out of the marketplace, but in the marketplace, you possibly, if you're eligible, could get assistance with paying for that plan.
Now, can you tell us a little bit about these subsidies? You know, you're talking about getting assistance. So if I decided, oh, it seemed too complicated, I didn't want to go through Access Health or sign up for the Affordable Care Act, and I want to get private insurance, I would go and I would have to select from what it is they offer. But I wouldn't be eligible, or I wouldn't even know if I was eligible for the federal subsidies.
That's absolutely correct.
Because the private insurance organizations do not offer any federal subsidies.
Right. Well, you bring up the word eligibility, which is really important. So this is something else that the Affordable Care Act has now established, which is the creation of a marketplace, Access Health CT. So through this marketplace, people can find out if they are eligible for expanded Medicaid, or they can find out if they're eligible for financial assistance with a qualified health plan. And so this is one place where you can find out all of that information.
Okay. Daisy, when people who have never had health insurance come to you and say, now, can you tell me what I'm entitled to or what I can get under this plan, what are some of the questions you have to ask them first to determine?
Well, basically, once we go through the whole process of the enrollment, basically because through the Access Health CT, the guidelines for the income guidelines have increased for people to be approved for Husky, Husky D, which is through the Department of Social Services, and it's a free health insurance coverage.
So some people for some reason have never had health insurance or were afraid to sign up, such as people who have foster children in their home and who get payments from DCF. Some people are afraid to sign up because they think the payments that they get for the children will be counted as income. Is it counted as income, and do they ask you those questions?
So what we want people to remember is that eligibility for financial assistance is through a process called MAGI, which is a modified adjusted gross income. But basically, we're looking at the IRS tax return, the federal return. And in the vast majority of cases, foster care funds and foster care payments are never included in the tax return. Now, there are times when that payment amount is included to assess the amount of financial assistance that people would receive for other programs.
Yes.
But we want people to first just come and let the website or the call center help you through the process so that you can determine what it is you're eligible for.
Okay. So for the rest of this segment, I am asking the three of you to think about what are the key things you think it is absolutely essential for people to take away, to know about, this piece, especially about signing up and what happens next. So why don't we hear from you first?
First, I'd like to say this is an opportunity for us as Navigator organization and as a sisters to really kind of change the perception and kind of cause a paradigm shift in the idea of healthcare and healthcare coverage, to shift from more a reactive standpoint to more of a proactive. So encouraging people to go to the doctor to do preventative medicine or preventative work as opposed to reactive, instead of reacting to your diabetes, being proactive
To manage your diabetes,
to diet and exercise. And so we really would like to remind people that having access to health care has been shown to really increase people's lifespan and overall quality of health through their lifespan. And so this is a great opportunity. For some people it might cost a little bit more, but it's an investment in themselves.
You mean more than not having health insurance?
Yeah, right.
of course.
More than not having health insurance.
Yes. Daisy, anything you want to add?
I think people should not wait till the last minute. They should, if they're ready, they should enroll by the end of March. It's very important because that way they'll have health insurance. Also, I would like to say that Community Action Agency of New Haven,
Yes,
we open open enrollment on Tuesdays and Wednesdays, 8 o'clock till 8 o'clock at night for people who work.
You want to give us the contact information? Go ahead.
It's 49 Community Action Agency of New Haven, 419 Whaley Avenue, New Haven, Connecticut. We have also 3 certified sisters, myself included, and we open Tuesdays and Wednesdays at 8 o'clock for a special program that we have for taxes this season and also for the health insurance.
So, but is it only 2 days a week that people can sign up? Or?
No, they can call in at our number.
Yes, give us that number.
It is 203-387-7700, extension 193.
And they leave?
They leave a message, and one of the assisters will be contacting them to enroll them and set up an appointment.
Okay, I think it's really important for people to know when you call that number, you will not get someone answering the phone, because if sometimes people don't get someone to answer the phone, they don't leave any information. It's really important that you leave your name and your phone number. Speak slowly so the machine records it clearly. And one of the 3 certified assisters at Community Action Agency will call you back and set up a time, but you will also provide information about what they need to bring with them.
Yes.
Which is one of the reasons why they call you back, because they want to make sure they set aside time to talk to you, to get all the information and to give you all the information that you will need and then come in at a time when it's convenient for you to get all the assistance that you need to sign up. Now, what about the health department? Tell us about.
So you can always call the New Haven Health Department, and the number is 203-946-2227. And you will also receive a voicemail and leave your information, and someone will be right with you within 24 hours.
Okay, and so you will call and follow up with that just the
Right.
same way. And people can, in fact, come to the health department
Right.
and that is at 54 Meadow Street
Correct.
in New Haven. And there is parking.
Yes.
We want people to know. And there's also parking at Community Action Agency. I know that has been an issue for many people, finding parking, those who drive, or if it's on the bus line, and both places are
And
on the
if
bus
they
line.
call us, we can make sure find an assister in their area. So we have access to over 80 assisters
Oh, it's
in the New
important to say
Haven
that.
region. And so if they call us, we will find out where they live and match them with an assister in the area.
Oh, that is so important because sometimes people have child care issues and they cannot come, you know, to Whaley Avenue, depending on where they live. But we also want to stress that regardless of where they live in the Greater New Haven area, with Hamden, West Haven, North Haven,
We have assisters all over.
you have 80 assisters, certified assisters. And so you do not have to be concerned about not being able to find someone that is within your area, because I'm sure with 8 people that are spread
Yes.
all over. Okay, as we close out this segment, anything else Denise you want to add?
I just want to say that Access Health CT has created the Navigator and In-Person Assister Outreach Program to provide in-person consumer assistance. We know that this is a new process, that many aspects of the law are just now coming into effect as of January 1, and we have trained and certified hundreds of people throughout the entire state. We have our navigator and our assister here in New Haven, but we have people who are ready to help you through every step of the process. I want to say that these people are trusted members of the community, that they are staff members of faith-based organizations, community action organizations, health providing organizations in your community, and they really are invested and really care about you and want to help you through the process. If you want to find an assister, you can also go online to ahctcommunity.org and click on assisters, and you'll find a listing of the assisters. You can also go to the accesshealthct.com website and select Get Help, and you can search for an assister by zip code or by town or by the name of the organization. But we encourage you to enroll by March 31st so that you can start accessing care.
Okay, and the Access Health CT website is up on the screen, and so the site is very clearly delineated. You can click on different buttons to get you to where you want to go. Now, we're moving into the next segment of our program, and in this segment, we want to give people the specific takeaways. Okay, so this is where we tell people about how to deal with the different plans that are available. Okay, and so also to talk about more specifically about the tax returns and the documents, because again, we want people to remember, we want to reinforce this. So let's talk about that. There to bring, I know you had mentioned it in the first part about bringing their tax returns for people who have been working, you know, and people who might have had insurance through a small group, like people might have had COBRA, things like that, and now they can go on the Access Health CT website and determine, or they can come and talk to Daisy or to you or to one of the 80 assisters throughout Greater New Haven. So tell us what are the specific things people should remember. So let's start with you, Denise.
Okay, when preparing to enroll, you want to consider who are the healthcare providers that you're currently receiving care from. You want to think about who in your home needs care, so that you can begin to gather information regarding all of the individuals that you're going to include in the application. We've been talking about this enrollment checklist, and the Navigator and Assister organizations have that, but if you'd like to view it online, you can go to accesshealthct.com and click on Learn More, and there are a list of FAQs. You can download the enrollment checklist, and it's currently in in 10 different languages.
And FAQs mean frequently asked questions.
FAQs
yes.
mean frequently asked questions, yes.
And it's in 10 languages.
Yes, it is.
Wow. So to say that, you know, for most people, they're probably in the most common 10 languages we can think of. And Daisy, at your office, two of you are bilingual, I know at least. Two of you are bilingual. So for people who speak only Spanish, they can certainly come to you.
Yes.
Now, I'm sure there are other...
Right. So all of the Navigator and all of the organizations are culturally and linguistically diverse. And so we can provide you any services as far as language that you need. So if you speak a specific language, just let us know, and then we'll make sure we find an assister that can help you.
That's another thing about leaving, the importance of leaving the name and phone number. Because if it's someone, you know, that might be able to leave name and phone number in English, but might not be able to carry on an extended conversation in English. And so when you call back, you'll get that kind of information. So you'll know how to line up someone who is culturally and linguistically compatible with the caller.
Correct.
That is really, really so important for people to know.
Yes, so we have assisters who speak 30 different languages, including American Sign Language. And if one of those 30 languages is not the language that that person speaks, we're also able to link language access through our call center.
Oh. Well, you see, and we don't hear these things in the commercials.
Yeah.
We don't hear these things in the commercial. Denise, please address some of the, so very specifically, some of the negative things we hear and how we want to, we want to let people know that any barriers that they hear about can be overcome.
So the first thing that you know, that people would say is that they can't afford health insurance.
Yes.
And so we want to reiterate that through the Affordable Care Act, people can now have access to expanded Medicaid for a family of 4. That means the income for that family is capped at just about $92,000.
Wow.
And so there are now new eligibility criteria that could make someone eligible for free health care coverage. But we also want to encourage people to come to the website, because it's at accesshealthct.com that you find out if you're eligible for financial assistance, a cost sharing reduction or tax credit to help you pay your premium.
Oh, so when they go to the website, they can plug in what they're earning and how many people are in the family. And again, as Kiana said, which I think was so important, to find out how many are in your tax family. It might not necessarily be all the people living in your household.
That's correct.
It's the people who you count on your income tax return.
That's correct.
Now, what about people who might never have filed an income tax return because they'd never had a full-time job, or they never had a job where they earned enough money that they think, you know, and some people just don't file taxes. That's the reality too. How will those people be dealt with?
And you can still apply. We would use your pay stubs as an estimate of how much you make, and then go on from there.
Now, you said you'll use your pay stub. What about people who are probably, quote, paid off the books? Because, you know, there are people who are paid off the books. And by that I mean people who might do day work. You know, they come in, they cut your lawn, and you pay them most often by cash, but even if you pay them by check, some of these people might work only during the summer. You know, they work from May to September. So they don't, and they might not have kept a record. Can they still get health insurance?
Yes, so for people who are temporary workers, seasonal workers, self-employed, they're able to present bank statements and other documentation to verify what their income is. And we know that there are some people who have no income.
Yes.
And they are able to write a letter to Access Health CT verifying that they do not have income.
And these people can get these subsidies. Tell us a little bit about the subsidies.
Right. So you're only eligible for financial assistance with a qualified health plan if you file taxes.
So there's definitely a benefit to filing taxes.
Absolutely.
Daisy, anything you want to add about what are some of the challenges as an assister you find in dealing with people who come in for help?
Some people are very hesitant and they don't believe in the system, Access Health CT. So trying to convince or to relay the information, the correct information, and once they go through the whole process, they are surprised and sometimes so happy because I had one client that she has to pay monthly premium of only $18.
Wow.
Which she wasn't shocked, and basically she was very happy because she had health insurance. She's never had health insurance, so working person. So, you know, it's answering those questions.
And the emergency room is not the
Right.
primary care center.
Exactly.
Okay, what do you want to add? What are some of the challenges that you face? Because the health department is a big department and you have all kinds of clients. What are some of the issues?
Well, we
you
have a
deal with?
department solely dedicated to Access Health. And so when you call that number, you will get an Access Health representative. And just, I would like to remind people that we are here for you, and please utilize us. A lot of times going on the website and doing the application by yourself is a daunting task. And we are here at free of charge to help you through the process, answer any questions. And if for some reason you have a particularly complicated application, we have the capabilities to escalate that to ensure that you get help.
Wow, okay. Daisy, do you want to, I don't know if you're prepared to say in Spanish just a little for people about the importance of coming in and getting the help you need so you can sign up. I know you're going to do a YouTube section, but do you want to just tell people how important, so the people who are going to watch the DVD, this program on the various public access channels, will understand that even if they've never had health insurance before and they're afraid, that come in and get the assistance they need to make a good decision. So you want to tell us?
You want me to tell it in Spanish?
Yes, can you?
Okay. El único lugar en Connecticut donde usted puede obtener descuento de seguros médicos del gobierno si cualifica. El Access Health CT es el mercado del seguro de salud y le estamos recomendando a toda persona que aplique para el seguro médico, que es bien importante.
Ah, gracias. Okay, so we want to just reiterate some of the things you have heard before we go into our closing segment. It is important that you find the help you need. There are many, many assisters. There are 80 certified assisters just in Greater New Haven. There's a health department which is at 54 Meadow Street, and there is a Community Action Agency at 419 Whaley Avenue. Both of these places provide on-site assistance. There's also 55 Church Street.
Yes, that's the Access Health CT Enrollment Center.
Okay, so
And
there's
it's open Monday through Friday from 10 to 6, on Saturdays from 10 to 4, and on Sundays from 12 to 4.
And
you
Sundays
can just,
too?
Yes, and you can just walk in.
okay. Say those times slowly again.
I'm
Say
sorry,
those, no.
Monday through Friday from 10 to 6, Saturdays from 10 to 4, and then Sundays from 12 to 4, and you can just walk in.
So 7 days a week, and you can just walk in. So you don't have to have an appointment. So if you
Right.
find that you are downtown New Haven and you have an extra, 45 minutes, you might want to pop in to, you don't have to have an appointment
No.
to be seen. Now,
And also
Sure.
another thing that I want to tell out is in this enrollment center they also have brokers. So if you
Oh,
have
who's a broker?
specific questions in regards to the health insurance, there are certified brokers there to help those clients. and selecting a.
So there's a broker at 419 Whaley?
at 55
Oh, at 55 Church
Church
Street.
Street, at the Enrollment Center.
Uh-huh. And what does a broker do, Denise?
So the certified brokers went through a training similar to that of the assister or navigator. They provide in-person enrollment assistance through Access Health CT. So they're using the same tool, the website. But the broker has an additional kind of scope and ability to really help someone to really select a plan. So assisters and navigators are asked not to recommend any particular plan, but it is in the nature and the work of the broker to really say, I believe this is the most appropriate plan for you.
Okay, so this, when we say a plan, we're talking about the bronze and, I mean,
We're talking about the qualified health plans. So
Okay,
those
s-
are the private plans, different from Husky, which is a public plan.
okay, so
So the-
Husky is a public plan for so that's sort of like an expansion of Medicaid?
It is.
Okay, but the Connecticut and Anthem and what's the other one?
Healthy CT.
And Healthy C. So those three are the plans available through Access Health.
Yes, that's correct.
Okay, those are the plans through which people can also see if they qualify for subsidies. Right?
Yes, that's correct. So those are the three carriers. I just
Okay.
want to make this clear. And then those three carriers, Healthy CT, Connecticut, and Anthem, provide health insurance plans in three different tiers.
Okay.
A bronze tier plan, a silver plan, or a gold plan.
And the broker can help someone signing up to determine whether bronze, silver, or
That's correct. So all the certified brokers are certified by all of the health insurance carriers. They have completed many of the same certification requirements as navigators and assisters, but they can recommend a plan, while the assisters and navigators do not recommend a specific plan or carrier.
okay. And within these tiers, by recommending a plan, the broker is going to help the person signing up to determine what they can afford and tell them what are the benefits that are available under, say, a silver plan as opposed to a bronze plan.
Yes, they will review the benefits with the individual. As a matter of fact,
And the cost.
Yes, absolutely. And as a matter of fact, something else that people should know that I believe we reviewed in the role play, when you are at the point of the application, when you're ready to select a plan, when you are comparing plans, you're able to look at something called the summary of benefits and coverage. So each one of the carriers and each one of the plan tiers presents a summary of benefits and coverage. And this will, it's a 4 or 5 page document that will review for people what is the copay, what are the deductibles, what are the basic costs and the coverage within that plan.
And you know, one of the things when we met to discuss this, and in the feedback you provide, you're saying it is important that people get this kind of help in so that they can determine the premium cost versus
Yes.
deductible.
Yes.
Because sometimes we might think, oh, this premium is low, so I'll go with the lowest premium, but the deductible might be higher, or the copay might be higher.
That's an excellent point. I was up at UConn Medical School a few weeks ago talking to a third-year med student, and as you know, college students are required to have health insurance coverage when they're on campus and they're enrolled, and she let me know that the plan that she was currently in, when she compared it to a bronze plan through Access LCT, she saved a great deal of money. So we're encouraging people to come and to see what they are eligible for.
And you know, you talk about UConn and students. We want to say to young people, it is really important that you sign up. Don't think because you're young you cannot get ill, or that you will play it by ear and if something happens you'll go to the emergency room. All it takes to wipe out yours or your parents' resources is one catastrophic illness. Also, you can remain on your parents' plan up to age 26 if
That's
you're
correct.
in school, but it's important to be enrolled, right?
Yes, you know, we pray that no one gets a chronic illness of any kind, but what's important is that when you have health care coverage, you now will have access to preventive services.
Yes,
right?
yes.
And so that's something else that we want to stress for people who believe that they are very healthy now. We want you to stay that way, and the best way to do that is to have a healthcare provider that you see regularly who can really track your progress and make sure that you're preventing anything that could come up in the future.
Yes, when you have health coverage, you'll go for your annual checkups. You will get advice. You meet with your care provider. You will get advice about what steps to take to prevent
That's
something
correct.
from becoming more seriously. If we can identify an illness in its early stages without exception, it can be treated more effectively if it's identified in the early stages rather than waiting until you're severely ill, going to the emergency room, and then ending up with a long hospital stay or something that they might not be able to treat as effectively because it is too advanced.
Yes, and it may not be a medical illness. There are also mental health and substance abuse services that are also available. And so again, these are all different services that are now under the Affordable Care Act and available through the health plans offered through Access Health.
Okay, they just gave me the 2 minutes time for the program to end, and so I'd like each of you to take 30 seconds to say something to the audience watching us tonight that you would like them to remember. Daisy, let's start with you.
Okay, I would like to say not to wait any longer. Get health insurance, it's really important. Try to enroll by March 31st.
Okay?
To echo Daisy, March 31st is approaching quickly. Call us, please, 203-946-2227. Even if you have questions and you're unsure, we're here to help you, so please call us and sign up.
That is so important. And don't wait until March 31st. I know you have until March 31st, but it takes a few weeks sometimes. If you show up to an assistant, you don't have all the right documents, you might have to come back another day. So it's important to call as soon as you can and set up an appointment and get the help you need. Denise, you have the last word.
Yes, by enrolling in a health insurance plan, you gain access to the essential health benefits and protections that are available through the Affordable Care Act. Through Access Health CT, you can access in-person enrollment assistance in over 30 languages through our Assister and Navigator organizations. You can go onto accesshealthct.com and you can create an account and complete an application. And also, you can find out if you're eligible for expanded Medicaid or for financial assistance to pay for your health insurance premium.
Thank you kindly. Thank you kindly. We at One World want to say to you, it is always better to light a candle than to curse the darkness. That statement was first made by Eleanor Roosevelt, and it is so true today as it was when she made it. Healthcare is a wonderful gift. It's a wonderful thing to have. It's a security blanket. It's a security blanket, and we encourage you not to wait until March 31st, to call the numbers showing on your screen, get the help you need, ask questions. There's nothing to be afraid of, nothing to be afraid of. These people are there to help you to get the assistance and the information you need to make a good decision for you and your family. We're glad you joined us for this 21st Century Conversation. Join us again for another 21st Century Conversation. Visit us on Facebook, YouTube, and on Twitter. Good night, everyone.